We are talking about a disease called retinitis pigmentosa, which is a kind of hereditary disease.
It has various modes of inheritance, but the symptoms are the same. During the early period, patients generally suffer from night blindness in childhood or adolescence. Night blindness refers to a limitation of activity in the evening. Parents tend to ignore this situation because a child, he does not understand it either.
Out of sight in the evening?
Just out of sight, without any other findings of fundus. Parents should pay attention to this at that time, considering why the child can't see.
So, what we can observe firstly is night blindness.
That's right.
Later on, vision will gradually decline.
With the growth of age, peripheral vision will narrow down into tubes, just like you are observing the world from the pipe. Activity is limited as well.
This kind of situation is the performance of retinitis pigmentosa, right?
Let's take the picture on the left as contrast. Picture on the left is the normal retina. You can see the color. The right refers to the typical retinitis pigmentosa. You can see it from the optic nerve. Its color has become wax yellow, which means it has been degenerated. Its retinal degeneration is too serious that it has resulted to optic atrophy. Its color is not as transparent as normal retina and optic nerve.
In terms of color, there is really big difference.
Additionally, you can look at the perimeter of the retina. There is lots of pigmentation. Also, its blood vessels is thinner. This is an expression of retinitis pigmentosa.
So, retinitis pigmentosa can cause optic atrophy?
Because the reasons of optic atrophy are various, optic nerve fibers suffers from degeneration and ischemia. So we applied this surgery to increase blood flow of arteria ophthalmica, because arteria ophthalmica supply blood circulation to retina and optic nerve.
Well, let's look at a diagram.
Arteria carotis communis is divided into two systems. On the left is the arteria carotis externa, while the right is the arteria carotis interna. As for the arteria carotis interna, it comes to arteria ophthalmica, and arteria ophthalmica provides optic nerve and retina with blood. If we hold back the blood flow of arteria carotis externa, the blood flow from arteria carotis interna to arteria ophthalmica will certainly be increased. When there is more blood supply to arteria ophthalmica, the blood flow to retina and optic nerve is also increased consequently. This might be helpful to improve the hypoxia and ischemia state of retina and optic nerve. That is our operation principle.
So, from this picture, I think maybe someone is still in doubt. If we just hold back the blood flow in arteria carotis externa, is there any corresponding symptom arise like ischemia in the arteria carotis externa supplied area?
No, because the anastomotic branch of arteria carotis externa system is very abundant, and there are other blood vessels to provide nutrition to these areas. It won't cause any hypoxia or ischemia situation. Please don't worry about it. This operation is effective for the vast majority of patients. Their central vision as well as peripheral vision have different progress. According to the objective test results like PVEP, ERG, EOG, there are obvious improvement after surgery. It can be observed that blood flow has also been increased by color Doppler ultrasound. It has a really commendable effect. I have a 55-year-old patient. She suffered from the illness for 2 years and found nowhere to improve her situation. Only 2 weeks after our surgery, her right eyesight increased from 0.08 to 0.8. The left eyesight progressed from 0.6 to 1.0, and peripheral vision has also been expanded.
Does this case demonstrate that there is no connection between the length of disease and the result of surgery? Generally speaking, the shorter the injured time, the better effect of surgery. Well, according to this case, this patient remained sick for a long time but still got a good effect.
That's right, this is not absolute because the cause of optic atrophy is considerable. Moreover, the length and the injury severity is different. The effect of treatment is not entirely the same. As for orbital trauma, for example, when the optic nerve is broken, even though you get treatment immediately, it will not recover anymore. Then, on the other hand, some diseases like retinitis pigmentosa, a patient suffered from it when he was very young and has treatment at the age of 20 or 30. The effect is very good as well. This is not absolute.
In terms of optic atrophy caused by retinitis pigmentosa, how was the effect of your operation?
In the past, we have operated on many RP patients. Most of them had good results. The visual acuity got improved and the peripheral vision got expanded. According to the review and follow-up, patients still keep favorable vision acuity without any vision decrease. The effect is commendable.
Just now we talked a lot. Eyesight can be recovered. So after a period of time, is it possible that eyesight might decrease again?
After the treatment, a majority of patients do not suffer vision decrease. On the contrary, their visual function keeps improving gradually. 2 years ago, for example, an optic atrophy patient, a peasant, got treatment in our hospital. When he came, both the vision was 0.02. Then, after treatment, the vision became 0.15. 4 months later, it turned into 0.4. Because of the poor financial condition, he only had operation on one eye, and now he is ready to have the other eye treated. But there is also kind of situation if we do not treat the primary disease completely, the result cannot be persistent. For example, glaucoma patients, after surgery, if the intraocular tension keeps abnormal or a new inflammation occurs, it is not a matter of surgery, but results from other inflammatory disease which cause vision decrease after surgery. The surgery has absolutely no complications and sequelae. It is quite safe and reliable.
That is to say, as long as we carry out the treatment according to the cause, then after the surgery, patient's vision could be improved, or at least it is in a recovery process.
The gene ontology of retinitis pigmentosa is complex. Generally, there are 3 kinds: autosomal dominant, autosomal recessive, and sex-linked inheritance. In order to check out how the patient gets the disease, we need to do chromosome check. If patients still have some remaining vision, the surgery will have effects. But for totally blind patients or only with light perception, the prognosis might not be that positive.
Today, we introduce a surgical treatment for retinitis pigmentosa, and its effect is undoubtedly commendable. Hope this way can bring the patient's twilight and blessing.